Director for the Upper Midwest Telehealth Resource Center. I want to thank you for joining us today. Our topic today is video conferencing platforms. And we're just going to have an interactive discussion. We did send out a survey yesterday, and I pulled that data down yesterday afternoon. I may not have all of the data that the survey now contains, but I've got this data set that we're going to look at today just to kind of kick off our discussion. And I do want this to be an interactive discussion today. I will pick on you if nobody talks. So we still got people joining. I'm going to wait one more minute. All right. So I'm going to go ahead and share my screen over here. And this is some of the data that came in early off of the link that we sent out on our survey yesterday. Just asking and trying to get a touch base on what different kinds of platforms folks are using for video conferencing for virtual visits or telemedicine or mHealth or eHealth or whatever it is that you want to call it when you're not in the same room with your patient during the clinical visit. So let me scroll up a little bit. Of these that we received yesterday, and this is probably about 3 o'clock in the afternoon, we had 3 people using Zoom and 3 people using Vidyo, 1 using Doxy, 1 using Skype, 2 using WebEx, 2 with GoToMeeting, and 1 Microsoft Teams. We also had someone using BlueJeans, which that's kind of cool. I didn't know that BlueJeans was still around. I hadn't used it in a long time. And you guys should have the ability to unmute yourselves. So are there other video conferencing products other than these several here that folks are using?
So hello everyone.
Hello.
I am interested in using Google Meet. And so when I saw Hangouts, I assumed you also meant Meet. I haven't used it because most people are familiar with Zoom, but I was curious if people have used Google Meet through the G Suite.
Anybody?
Is that HIPAA compliant?
Yeah, if it's through G Suite with at the business level where you're actually paying it and not through regular Google, then yes, because there's a BAA.
Okay.
So the entire G Suite is apparently HIPAA compliant, including the drive and everything else. And they'll give you the BAA at even the $6 a month level. I got the $12 a month level for some reason because there was like a 20% off coupon when I registered. But I just haven't seen a ton of people using it, but it seems like a really great, so I'm a neuropsychologist, so I do mostly testing. And so I'd be using it primarily for feedbacks and things, but getting into possible virtual assessments. So I don't need a huge platform for like client docs and progress notes and all of those things, which I find things like Simple Practice really helpful for. But I just wasn't sure if most people were using these for therapy, and so you were using a lot of the other platform stuff, or if you were using it for testing or kind of where people were with that.
Yeah, I hadn't heard of Google Meets before, so that's a new one on me. But absolutely, if they are giving you a BAA and you're using with the G Suite, then it's HIPAA compliant, and I wouldn't worry about that. I wouldn't worry about looking for something else. I mean, that's one of the things we're seeing with COVID is a lot of we've got the waivers, so you can use things like the consumer version of Skype that's not HIPAA compliant during this waiver period. But as a telehealth resource center, we know this waiver and the public health emergency that we're going through with COVID isn't going to last forever. There will eventually be time when CMS will come back out and say, hey, if you're not on a HIPAA compliant platform, be careful because you could get dinged. So that's definitely something we do recommend. I mean, if we were in March right now, I'd say use whatever you can use because we've got the waiver. But now we're 6 months into this. It's time to really make sure that you're on a HIPAA compliant platform. Other products that people are using that I want to talk about.
This is Sarah from Cameron. We have Epic, and so Epic's MyChart app has that capability. So that's what we are using for all of our systems. The only difference would be we do have a school nurse in one of our community schools, and we use Salus there, which allows the video and stethoscope capability for our providers.
Yep. I've used the MyChart with a couple of my doctors that I've seen. I've also used Zoom with one of my doctors, and one was using, I think, Doxy.me, I think.
Sarah, I had a question for you. This is Jeremy from Grand Rapids, Michigan. I am the Blue Jeans user. We use it for Pine Rest, mental health institutions. You know, we're pounding that system. We're doing probably 2,000 visits a day on it.
That's awesome.
And it's not really made for what we're doing, to be honest with you. They understand that they need to be in the medical space. So we've been working a lot directly with Blue Jeans, getting their system up to speed. But that's one of the things that we're looking forward to. We're an Epic shop, and we're looking for integration. We don't have that right now. We're looking to get that. We have an RFP coming up. Yep. You had mentioned MyChart. From what I understand at Epic, we have contacts there that they don't actually have their own client yet. They're actually using a Zoom or a Citrix basically to push that out through MyChart. What are you guys using out there right now for Epic integration? Do you know that technical side of it?
So what I can say is that the patient is on their side using their MyChart app, and the provider on their side is using Haiku, which I think is a secure link into.
There is, but you don't know what programs actually, because Epic doesn't really have, they're working on it. They have their own proprietary like Zoom basically that they're gonna tie into Epic, but right now they have what they call an Epic Apple Orchard, and multiple of these vendors can play nice with Epic. So likely there's a vendor probably behind your system too. It doesn't sound like you may know what that is though, but that's okay. I was just curious because we're looking to head that way.
Yeah. And
Hi, I'm Chelsea Shabransky. I'm from Munson Healthcare, rural health system in Northern Michigan, and we work with Pine Rest, Jeremy. Right. So I'm familiar. We are using CareConvene right now. It's a kind of a local Michigan app.
Yep, we've heard of them.
Yeah, we're actually evaluating and looking to move to a new platform. CareConvene is missing some functionality that we see in others, like multi-party visits, document sharing.
Sure.
And there's some technical issues too that we think might exist there. So we've evaluated. I think we're leaning toward Doxy at this point, and would love feedback from those on Doxy. We hear really good things about it from our providers. Around success rates, even for patients with limited connectivity, and just the amount of functionality it has.
Others? Thank you, Toy, for putting the G Suite reference in the chat.
This is Sandy Hall. Sorry, I didn't do the pre-work link, so I apologize.
No worries.
But we use Vidyo, VIDYO. I saw it on there from others. And is there another, sorry, I joined late as well. Is there anything else that you wanted us to answer, or just which one we're using?
Just no, that was the pre-survey was not necessarily homework, but something to give us a launching place to start our discussion for today. So thank you, Sandy.
Yep.
I can't hear you, Andy. Nope. So, well, Andy, oh, nope, not yet.
Hold the piece of paper up.
Andy's working on his audio. Anyone else? We did have, did she go away? Marie Lee, are you still on here? We had someone that I know is using Tyto, and I didn't put Tyto on the list yesterday. Is anybody else using Tyto? What other platforms are you guys using, or what types of services are you providing via video conferencing?
Hi, this is from Southeast Healthcare. We're using Doxy, and then we're also using GoToMeeting for our groups. And we've been trying to do kind of a hybrid group. Some folks who have no technology access can come into the office, and then those who have that technology. It's not quite gone as swimmingly as we'd hoped. So we're still continuing to try and work that through with the group process. So I'd be interested if anybody else has got some experiences that have gone well for them in that arena.
Does Doxy not have the group? Is that why you're using GoToMeeting?
We don't have that function as a part of the Doxy that we have currently.
Gotcha.
I can't remember if it's Doxy or Doximity that limits group to 4 participants. But we sent out an RFP recently just to see what else was out there as part of our internal review. Again, using video, to answer your question about what types of services, so we're doing psychiatric evaluations and ongoing E&M services, individual therapy, family therapy for children, adults, families. That includes mental health and substance use treatment, group treatment. And so that includes like intensive outpatient groups that are meeting multiple times a week, as well as mental health day treatment groups. Meeting a few times a week. Sometimes it's a combination of some participants in person, some remote. At times it was all virtual or remote. We've used it for some of our primary care services as well. Psychological testing and evaluation. And we recently moved our kind of patient registration process so that they're the ones kind of initially coaching and teaching the patient how to use it before that clinical assessment service for new patients coming in. So we're basically using it in all of our service lines except residential. However, what we did is we allowed our residential clients to use our video software so that they could stay connected with their friends and family because we stopped visiting hours from occurring. So we kind of equipped those residential sites with tablets and allowed them to be able to use that software to stay connected.
Very good. Others? Andy, did you get your issue figured out?
I can share. I have a mental health practice, and somebody mentioned using Simple Practice for their records management. I also use it for their video telehealth, but I have Doxy as a backup because sometimes you just can't count on things, so you have to have a backup. I like Simple Practice because it sends reminders. So it helps people to remember to actually log in for their appointment.
Yeah, I know, back to the question on Doxy, I think they allow up to 10 participants now and are working on expanding that to 15. So I know others don't have a limit. That's where they're at right now.
Yeah. Some of these Blue Jeans especially, we just rolled that out. I mean, you know, they're fairly big, but they're not as big as Zoom and these guys, and they want to be up there. And they actually limited their meetings to 9. And we've been hounding them forever because we do tons of group therapy and they only can see 9 at a time. And we just released that push to show up to 25 now. I believe Zoom does at least that, 25 to 50. So,
Yeah.
but yeah, I mean, I think it was Sandy that spoke earlier. I mean, Pine Rest does everything she talked about. We have people using iPads that you don't have, computers at home, whatever, and then they have a Blue Jeans account that we give them, and if they're guests or patients, whatever, obviously they don't need to own one, but if they're a clinician, we give them one, and kind of that's how they take care of everything that they're doing patient-wise is, video, iPad now. I mean, we have inpatient residents, but I'd say probably 80% of our company is probably higher at home, I mean, everything lives in Blue Jeans right now, and I don't think it's really built for that level because they keep telling us, wow, you guys, we want you in our magazine, yada, 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 but we're not supposed to like endorse any company, so we can't. But I mean, I think they want our business, but we have that RFP coming up to it. It sounds like a lot of people are doing the same thing, trying to figure out what's going to position them better for the future to, handle this new pandemic. I mean, I'd be surprised. The studies I read about telehealth, this is one of the areas that has not gone back. A lot of your physician have, done some in person, but a lot of people really enjoy this telehealth, and statistics show actually people that are depressed and, have trouble getting out of the house actually meeting their appointments more now than ever. The no-shows have gone down because it's just so easy to, just sign in on your app now. But what it does, it's just like everything with home users, it puts all kinds of onus now on your home equipment, the internet and, rural areas. I mean, these are all things that Congress knows about as well. It's not just coming into the office anymore. Oh, you can't get a ride, I'll get you one. I mean, now we're reaching people we haven't before, but the infrastructure's not there. And an IT guy like me can't help them. You only can do so much if it's their internet service provider. So
can I ask, and maybe this was going to be a question already, Becky, so I'm sorry, or Autumn, I'm sorry if I'm stepping on toes. Can I ask if there are platforms that people have tried, because I'm relatively new to using the teleservices, that people have tried and just dropped because it just wasn't working or clients couldn't like manage it well or anything like that? Like, is there anything that you're kind of like, yeah, don't use that?
Great question. Anyone?
So it sounds like anything is good as long as it's effective and HIPAA compliant. Like
Yeah.
Clients have been able to use it pretty well.
Yeah.
I don't think there's ever one silver bullet. I bet there's one thing that everybody says that they don't do well, and a lot of that is your company adapting to telehealth too. We found that here, that, there's been some processes that didn't really jive in telehealth, or they were using video services for conference solutions in-house, and then quickly everybody went home. And then we realized that we couldn't handle, the way that they were doing it, and trying to get them to change it is, really hard. Culture is a big thing to move in a week. So yeah, I think you're just kind of surviving at this point, finding something that plugs all your holes until we know
we
where we're
found
headed.
too that technology is one piece of it, but there's so much more that goes into making a video visit successful, like patient educational materials, making sure they're ready on their end, telling them, if you have good Wi-Fi, you're in a good spot, but if you don't, try to go to like a public hotspot or somewhere else. So I think a lot of that prep can help, lead to a successful video visit.
Yeah. Statistically, we have stats on mobile devices. We're at probably 55% mobile. So obviously more than half people are all wireless. That poses significant problems too for connectivity. We really try to enforce to our physicians that, hey, you need to be hardwired, to give the patient the best experience, but we know that's not realistic nowadays, right? I mean, everybody wants to connect at Wendy's or at their cottage up in the woods. So, there's just things that they have to take in consideration and, think about, and it's not just flicking it on and go. There's all kinds of problems. And when things go down, people are like, well, it was sporadic. Well, yeah, that's the internet, video is that much worse. You don't see it when your Word document doesn't connect right away because it just tries again. Video, you're going to see a hiccup.
Are you guys familiar with the Federal Communication Commission's Lifeline Program? Anyone? So I'll pull up the link and we'll take a look at it, and I'll put it in the chat. So this program has been around for a long time, and it's for those that are on Social Security or WIC or SNAP, any type of federal program. And they can get, there's three options. They can either get a low-cost cell phone, which was going to give them cellular ability to do apps on their phone, or low-cost home telephone, which is really where the program started back in the 90s, and then low-cost internet at their house. So I'll pull that information up. But that's some of the folks that we've talked with over the last several months, where their patients have broadband issues. This is what we've recommended to help resolve some of those issues. You know, going to a local hotspot is fine, but you still want your patients to have privacy. And, you know, the onus is on them when they consent to the telemedicine platform, that they're consenting, if there's people around them, they're consenting to letting those people know whatever public or private health information they might say.
Yeah, we've done a lot of work in this area. We're in a really rural area, and would love to hear what others are doing. We've started to partner. A lot of our libraries have free Wi-Fi that you can access from the parking lot. So we're directing patients to go there and complete it from in their car. We also have libraries that are lending out like AT&T hotspots to patients, and they're going to start reserving some for telehealth patients. So some of that we're starting to work with, like community resources, to try to help. It's a big problem in this area. I don't know if others have found any way to try to proactively help patients who might have limited broadband.
Chelsea, in your opinion, isn't the bigger issue though, at least up in that way, is just broadband in general? I mean, fine if AT&T is up your way, but you know, I think coverage, you know, things like 5G and putting towers up, you know, that stuff's expensive, and they're not just gonna put one up there if they don't see a return on it. So I think a lot of it congressionally is pushed, you know, that, hey, you know, this country really needs a lot more coverage for things. And I think that's why you're seeing things like satellite technologies and stuff being discussed too, you know?
Yeah, I know we're trying to do that too. We're having conversations with some of the broadband providers and trying to push them to expand access. So we're trying to directly do that. They're finding a lot of demand, especially with virtual education too, is huge right now. You know, people are really finding an additional need for internet. So yeah, we're trying to get creative wherever we can, but it's the infrastructure just isn't there right now.
Yeah, so I'm going to share this link real quick. There's a 1-minute video on here. I want to play for you guys.
People across the United States rely on phone and internet to stay connected to family, work, education, and essential services. Lifeline is a federal benefit that lowers the cost of phone or internet service. Qualifying customers will get $9.25 towards their monthly bill. Consumers who live on tribal lands can qualify for an additional benefit. You qualify for Lifeline if you use SNAP, Medicaid, or other qualifying federal or tribal programs, or if your household income is 135% or less than the federal poverty guidelines. You may also be able to qualify through your child or dependent. This benefit can be used for phone, internet, or bundled service. A household can only receive one Lifeline benefit. 10 million people in the United States use Lifeline to stay connected. You could be one of them. Find out if you qualify today.
All right. I was thinking about something and I lost it.
Hey, Becky, this is Andy.
Oh, hey, you made it.
I learned something today. When you run a Teams meeting and a Zoom meeting at the same time, they don't like each other.
Yep.
So, hey, my name is Andy Hoying with Teledoc Health, and I just wanted to make the team aware of a couple of new products that were launched in Q3 that may be of interest to your team. In this quarter, we launched a new product called Solo version 2, which is a low-cost, standalone, HIPAA-compliant, high-trust certified solution that allows you to connect not only WebRTC, but also SIP. So you could use it for both outpatient and inpatient. It's super popular right now. Also, two more, if you're looking for a super low cost way of doing scheduled follow-up, whether it's in a clinic or in the patient's home, we are both in the Epic App Orchard, having a Epic embedded solution, and just announced we just got into the Cerner Code program. So both of those start at $9 a user a month and go down based on the number of volume of users you order. So if you're looking for a low cost, leverage your own EMR, it's a wonderful solution. But anyways, just want to make you aware of some other options.
Absolutely. I remember the other thing I was looking for, I'm trying to find it. The FCC is released the guidance for their connected care pilot program. And this is funding that healthcare organizations can submit a proposal to get to help build that last mile of internet into residential areas. I'll find it and we'll send it out. I've seen the order, but now I'm not finding it. So we'll get that out to everyone via the email that you registered for today's call on. We've got 2 more minutes left in our scheduled time for today. So any other questions or anyone else want to share what they're doing in their organization?
Hi, Becky and everyone. This is Marjorie with Indiana Department of Health, and I appreciate the discussion today. I was curious mostly about diabetes education and if anybody is using a group format and what's working well and what isn't working as well in a group format for diabetes education. Thanks.
This is Sandy Hall. One of the other kind of vendors that we partner with for a patient wellness app is My Strength. They've since merged with Livongo, but we then provide that and make that available to all of our patients. So they can use it whenever they want between sessions in addition, but it does include, since they've merged with Livongo, also some self-guided education and support related to chronic medical health conditions. Also includes like spiritual health, sleeping, behavioral health, a lot of different evidence-based protocols. But that's what we're using. And then sometimes when we're doing groups, our clinicians might bring that up either on a one-on-one session or in a group session with clients and kind of watch some of the videos or go through that to kind of reinforce the clients being able to use it on their own outside of intervention sessions.
Yeah, we're using Zoom right now for any group education or group therapy.
This is Andy. I have a customer actually in Indiana that uses both embedded in their EMR and solo for the purpose of Epic doesn't always handle unknown patients well. So solo gives them the ability with just 2 or 3 clicks to launch a visit. Teledoc is in the acquisition phase of Livongo. That deal will close in Q4. But their exciting thing about Livongo, like Sandy shared, is all their devices are cellular. So they focus on 4 chronic conditions: diabetes, hypertension, weight management, and obesity. And the great thing about it is you don't have to worry about the connection issues that you commonly see with browsers or Wi-Fi. So it's a wonderful option if you'd like to learn more, and I'm happy to help.
Thank you, everyone.
Any last minute comments or questions to share before we close for today? All right. Well, thank you all for joining us. Have a great weekend.
Thank you.
Thanks.